Bullous pemphigoid, BP, is a skin disease that makes the top layer of skin separate from the layer underneath, creating large fluid-filled blisters. It most often appears in people over 60 years old and is not contagious. Think of the skin like a two-page book. BP makes the pages pull apart, leaving a bubble between them. BP happens when the body's own immune system makes antibodies that attack two proteins, BP180 and BP230, that hold the skin layers together. These mistaken antibodies can be triggered by older age, certain medicines like diuretics or antibiotics, infections, or other illnesses such as Parkinson's disease. Imagine a security guard, the immune system mistakenly targeting the door, hinges the skin proteins that keep a door closed. The first sign is usually intense itching. Soon after, red or pink patches appear, and within hours or days, a tense blister, a bubble that does not easily burst, forms on top of the patch. Blisters are often found on the belly, thighs, underarms, and flexed areas of the arms. A simple way to picture it: think of a mosquito bite that never stops itching, and then a small water balloon pops up on the skin. Doctors diagnose BP by looking at the rash, taking a tiny skin sample biopsy, and checking it under a microscope, and using a lab test called direct immunofluorescence that lights up the antibodies in the skin. Blood tests can also detect the circulating antibodies. Treatment starts with strong steroid creams applied to the rash. If the disease is widespread, oral steroids or other immune-modulating medicines, such as doxycycline, methotrexate, or newer drugs like dupilumab, are used. The goal is to calm the immune system and let the skin reattach. Because the exact cause is not fully known, BP cannot be completely prevented, but risks can be lowered. Avoid drugs that have been linked to BP, keep the skin moisturized to reduce cracking, and treat any other illnesses promptly. If a person notices persistent itching followed by a blister, seeing a doctor early can stop the disease from getting worse. Recent research is looking at the role of specific immune signals called interleukins, IL-4 and IL-13, in BP. Drugs that block these signals, such as dupilumab, originally used for eczema, have shown good results in small studies. Scientists are also exploring blood-based biomarkers that could predict who will develop BP and testing other biologic medicines like omalizumab. These advances aim to give patients treatments that work faster with fewer side effects.